Good morning. Welcome to the Morning Coffee, part of Provoking Safety, the channel where we think, talk, and do safety with the intention of provoking safety at home and in the workplace. The Morning Coffee gives me the opportunity to touch base with you, talk about safety things, and hopefully provoke safety in you in such a way that it'll stick with you throughout the day at work. Today is September 11th. September 11th, 19 years ago today, was a tragic event that occurred in American history and affected the world. Many people lost their lives, and as a result of either the disaster or trying to care or rescue those that were affected by the disaster. Terrible incident, and at Provoking Safety, our heart goes out to those that lost their lives and the loved ones that they left behind. Today, as I promised, I'm going to follow up with yesterday's video regarding mental health in the workplace, and just to follow up on World Suicide Prevention Day. And I want to talk about resources that you have in the workplace. So let's dive in and have a quick look at the articles. This one comes to us, it's a Winnipeg article, but it's the Canadian Mental Health Association has released a mental health toolkit to aid back to work and anxieties. Now the good news is this toolkit isn't just COVID-19 centric. It has a lot of principles can be applied in most situations to aid in the mental health and mental well-being at work. One thing that's important to note with health and safety now is the health and safety focuses on healthy workplaces are safer workplaces, and mentally healthy workplaces are also safer workplaces. So it's a good idea to consider the mental health as part of your health and safety program. Now, the CMHA has recognized that with so many unknowns lurking around Canada's new normal, just to borrow wording from the article, there are increased anxieties at work. We know that already people struggle with mental health issues at work, and this is adding to that burden. Some that have never had issues with mental health at work now are experiencing anxieties just because of world events and what they are right now. This toolkit was developed by CMHA Ontario, but has been made available to all of the provinces through the different chapters of the Canadian Mental Health Association. What I'm going to do is leave a bunch of links for different resources, but for the toolkit, I'm going to leave two. I'm going to leave the English translation and the French translation as well. Important to consider, put it to use. Now, another group, Big Think. Big Think is a company and an organization that promotes workplace learning. Now, they've done a good article here on mental health and what it means to an organization. 1 in 4 people will likely experience a mental health problem at some point in their lives. I didn't think it was that high, but also not surprising. Unfortunately, 800,000 people will take their own lives every year. If I was to put it in perspective, it's a little over, well, it's quite a bit over, but it's over half the population of Calgary. So it's like half the population of Calgary is gone. So that's disconcerting. That's a lot of people. Also, they've taken and noted some studies that between 2005 and 2015, people living with depression increased. Now, that could be possibly because the stigma is being reduced and more people are coming forward. But the fact that mental, neurological, and substance use disorders account for 13% of total global increase in mental disease, and that's an issue. So it's important. Consider this as part of your workplace health and safety initiative. I'm not saying disregard all of the previous issues with health and safety. This is something else that has to be added to health and safety. It's important to understand that 6 in 10 people say mental health impacts their concentration at work. Estimates are that 70 million workdays are lost in the UK, for example, from poor mental health. So let's put that in a worldwide perspective that becomes huge and staggering. Now, in another 2008 survey done right here in Canada, just 50% of Canadians would tell their friends and coworkers that they have a family member with mental illness. I wonder how many would actually say that they had a problem with mental illness. I bet you it's far less. Partly because people aren't empowered to talk about it. Something that should be notable for everyone within an organization is $1 of investment in treatment For depression and anxiety leads to a return of $4 in better health and ability at work. If you're looking for a way to push a mental health initiative through at work, that's a good ROI statement, really, when you think about it. I'll include, of course, this link below as well. And finally, what I'm going to include is this link from CCOHS, the Canadian Centre for Occupational Health and Safety. They're phenomenal, and they're an excellent resource for information. And they have a lot of links on mental health and wellness and health and wellness at work. So I'm going to leave this one link with all of the links in it, and feel free to check it out. To summarize though, a mentally healthy workplace is a much safer workplace. Think about it. If everybody has this sense of security and sense of well-being, won't their work be that much better and won't they be more productive? Health and safety professionals, if you haven't done so yet, consider how you can add this to your health and safety program. Health and safety committees, much the same thing. Company owners, C-suite folks, executives, consider how mental health initiatives might be part of your new way of doing business. That's pretty much it for today. I wanted you to do me a favor. While you're out and about, think safety, talk safety, do safety with the intention of provoking it at home and in the workplace. If you like this video, do me a favor, click the like button below. If you didn't like it, clobber the unlike button. But let me know why. Okay, leave a comment. And if you're new to the channel and haven't subscribed yet, do me a favor, click the subscribe button. Yeah, click it right here. And ring the bell and click all, and you'll get notified of new content. Anyway, that's it for now. Bye for now. Take care.